Welcome to very warm welcome to the Catalyst interns, the PIs, the project teams, and I hope your projects are going well. And of course, thanks to Nate and Sohaila, our Catalyst team, and all of y'all. So it's a great pleasure to welcome Darren Cook. And Darren is the interim chief innovation officer and entrepreneurship officer at UC Berkeley. And besides all of that, he also is, I think, the director of the Life Science Entrepreneurship Center at UC Berkeley, past chair of the BioTrack at Berkeley Skydeck, an investor and former chair of the Medical Device and Digital Health Track at Life Science Angel. And before all this, he was an he got his law degree, has been a patent litigator, a patent attorney at Biorad, and before all of this, and he also teaches with the NSF I-Corps program and the NIH I-Corps program at Berkeley House School. And of course, before all of this, he was a mechanical engineer and worked at UCSF on, is it a cochlear implant?
Yep.
Yeah,
ENT
so
program.
that's his UCSF connection. Erica, I will introduce you before you speak, if that's okay.
Sure.
So take it away, Darren.
All right. Whoops. What's going on with my share? Here we go. Um, yeah, thanks, Rupa. Thanks for having me here again. As she just mentioned, I'm Darren Cook. I run the Life Sciences Entrepreneurship Center at UC Berkeley, a center that I started with Rich Lyons in 2021 as a virtual center to tie together resources across the Berkeley campus. When Rich Lyons became the chancellor of the UC Berkeley campus last summer, I inherited his old role, which makes me the interim, for a year, Chief Innovation and Entrepreneurship Officer for UC Berkeley. As mentioned, I don't do this much anymore. I do have a faculty appointment at Haas until 2027. I don't have time to teach anymore, but I have an MBA course, an undergraduate course. I used to teach the I-Corps class that was life sciences specific. It's now being taught by somebody else. And also, the same life sciences specific I-Corps class is available at UCSF once a quarter, I think. So phenomenal teacher, Sayan Yoon is teaching that. Um, yeah, Skydeck, investing, etc. And yeah, I was an attorney. We're going to start with, I'm going to encourage you to put something in chat. What's your guess? What percentage? What do you think statistically? What percentage of startups don't make it? 70%. What else? What do people think? Yeah, 99.999% don't make it, right? Whatever it is, it's the majority. And most people say, yeah, vast majority, right? Funny thing is, I really tried to figure out the number. I'm like, hey, what percentage is it anyway? And it, really depends on how you define startup, failure, don't make it, whatever. But pretty consistently, people are saying, yeah, 9 out of 10, 9 out of 10. But why is this happening? Consistently, why is this happening? Even in the best accelerators and incubators. Well, this we actually have an answer to because once you know you have a failed startup, you can just go ask them, right? What happened there? And what we're consistently seeing is that they're not making it, not because of the product didn't work or the team fell apart, was because they were what? They were trying to sell something that not enough people wanted. This applies as well to life sciences. You'll see in a second how this this fits. But there are other reasons, running out of cash and not the right team, and you got outcompeted. But and this blows me away because this is 101 startup postmortems asking the CEOs themselves, hey, what went wrong? Are they really all admitting, yeah, whoops, we were building something that people didn't want to buy? Yeah. And it's amazing how frequently this happens. Here we go. Watch of the Month Club. This was from 2018. And even then, $139 a month to get a different watch, I guess, every month. You can predict what happened with that. How about this? So the smoke alarm that's turned up to 11, right? And luckily it's internet connected, so when it goes off, you'll see it on your phone. Yeah. What do you think? Enough people wanting to pull off the normal sensitivity smoke alarms from the ceiling? No, no, what ran out of business, right? But you're probably thinking, hey, you're life sciences experts, you're working on medical innovations. Those previous examples were kind of dumb, right? What if there was an app, a system to connect cancer patients with clinical trials? Well, that sounds important, right? That sounds like something that people actually do need. What if that system and app raised close to $100 million from Li Ka-shing and other big investors, and it was founded by someone super smart who knows the business, right? Rhodes Scholar, Harvard Medical School, Cancer Center faculty. And at this point, I'm going to pause because I've been given this presentation now since 2018, and I live in fear that somebody right now is texting Will Polkinghorne saying, "Hey, Will, some jerk has your picture on the screen." And it's yet to happen. Actually, one class I was giving for I-Core class, someone put in chat, it's like, "I know him." I'm like, "Oh no." Turns out they were not friends, so I dodged that bullet. Anyway, yeah, Will Polkinghorne. There's an app for War on Cancer. There's an app for that. Co-founder of Driver. Everywhere. CNN, CNBC, Bloomberg Tech TV. And what happened? You can predict, given the setup, right? We ran out of money. Uh, okay. What happened here? Okay, so they were trying to raise another funding round, wasn't making money fast enough to convince investors to give it the money. Oh, they had partnerships with 30 cancer centers. That sounds like a good thing. Oh, but they weren't paying them. That's a bad thing, right? So we have a system here that a lot of people intuitively thinks is a good idea. They have partnerships, but no money is changing hands. The investors got wise to this, said, "Look, we're not going to keep investing in you if you're not going to be a viable business." And it shut down, right? November 2018 came and went. So how do you avoid that? Avoid this. This is a setup now for the pitch deck part. I'm going to suggest you're going to be inspired, I hopefully, with the 10 easy steps for a good life sciences pitch deck. So I'm going to go over something that I put together back in, 8 years ago after I came to, well, let's see, I was invited to a conference with my investment group at the time, and they said, "Oh, good news. 100 teams want to meet you." And I look at the calendar and I have 5 spots. And they said, "So you're going to have to pick," the conference organizer said. They sent me 100 pitch decks. Like, okay, let me just sit down and read these and I'll pick 5. And I did. And I got to the end, I picked the 5. And then I reflected, how did I pick the 5 that I ultimately chose? And there was a common theme. And I boiled it down to these 10 easy steps for a good pitch deck. First 5 are really the makers and breakers of the deal. You're going to see if you don't have the first 5, it doesn't matter what the next 5 are because you don't have a company. Let's look at these first. Number 1, you start with a problem. Believe it or not, most people don't because you think, well, yeah, I mean, obviously you would, right? No. What are most people starting with? They're starting with their IP position or almost always the tech, right? Or worse, the team. I mean, whatever it is, no, you got to set it up. What's the problem? And then how big is it? Again, obvious, but a lot of pitch decks don't go in this order. How big is it? Everyone knows diabetes is a big problem, but what's the geographic scope? What's the number of patients? What's the financial implications? Remind us. And then number 3, you fixed it, right? You just set up the problem and that it's huge. Now show us the data. You fixed it. Like it's great. And not just great, it's exceptionally great. So the test I like to think about on this is if you've got a skeptical colleague, one of these frenemies who are like doesn't really want you to succeed, you know who they are. If you can convince her that you have an exceptional solution to this huge problem, that's what we want to see too as investors. We're your skeptical colleagues, right? We want to believe, but we have to pass on 99 out of 100 deals. So we're going to be look for every opportunity to pass. And then five, the hardest part, and this is where driver went awry, right? The solution's irresistible to someone who's going to buy it for you for money, right? This is the tricky part, and this is what I teach, or I used to teach in the I-Core classes, how to understand the market needs and market motivations of a diverse set of parties that many of them have to say yes. I'll tell you, investors are all leaning in at this point because they want to know, do you understand? They want to know if you understand where you are on this graph, right? What you control in terms of your tech and what you're doing in your lab, et cetera, is that, how good your solution is. Hopefully, it's an exceptional solution to a huge problem. What you don't control is the scope and scale of your customer's problem. This is what the customer's problem part is exactly what we teach and what we do as a workshop in the I-Core program. So if you're interested in market needs finding, understanding market motivations, that's the y-axis here is what we think about in that class. So anyway, notice I didn't say anything about the team or the IP or the regulatory landscape or anything. Why? It doesn't matter, right? If you don't have a repeatable, scalable business model, which was number five, then it doesn't matter who the team is. It doesn't matter what the IP position looks like, but they're still important. Yeah, you have a team that can do this. You've been there here before. It's a diverse set of folks with different complementary skill sets. Revenues are going to be huge. IP, especially in the life sciences space, or gives you a competitive advantage. You have freedom to operate, FTO, meaning that you've looked at third-party patents and understand what they cover and how you get around them. This is purely for investors, right? The investment, whatever your ask is going to take you someplace interesting and important, either to current investors or to future investors. And also, what are you going to do with it, right? And then 10, investors are doing this to make money. So remind them, this is other people have made money in this space. Exits, comparables, multiples, whatever it is, that could be true to the investor you're pitching as well. All right, so to recap, problem, huge problem, you have a solution, it's exceptional. You're going to get these slides, by the way, so don't feel like you have to take notes. Uh, Business model works, you have a team, all this stuff. Obvious? Um, Perhaps, but most teams don't do it this in this order. Let me give some pointers on some specific points because I see again and again what I would call issues or points where you can improve in particular areas. The huge problem, right? This is an opportunity to bolster. So let's put it this way. When you're teeing up the huge problem, think about whether it makes sense to put the existing solutions, which could be your competition, right up front. I know it's counterintuitive to a lot of startup teams because they're like, "Whoa, we don't want to lead with our competition." But what if you set it up like this? You say, "Look, there's a huge problem. Look at all the people who are trying to fix it, including big companies, small companies, other startups." That's the competition slide right there. And then next, exceptional solution, boom, you blew them out of the water. Think about that. Put the competition right up front. It gives you a chance to leapfrog them and also to emphasize how big the problem is. Number five, solutions irresistible to someone who's going to buy it from you at a profit. Pop quiz. We're really short on time on this, so I'm not going to have you type into chat, but think for a moment. Who are the five parties in a regulated and reimbursed life sciences startup space who must be an enthusiastic yes, not just like an okay, enthusiastic yes before your innovation's adopted? And I'll pause for a second. They all start with P, at least in my framework. All right, were you guessing this? The patient, the provider, the payer, the partner, the permitter. No one calls the FDA the permitter, but if you're going to make them all start with P, you have to make some adjustments, right? Yeah, this is exactly the model that we use in the I-Core program, and it looks like this. So here's a team that came out of UCSF. They did my I-Core at LSEC program, 1 week boot camp where they did 16 interviews, 16 customer discovery interviews over the course of 1 week. And this is what they came up with. So this is an eye tracking technology for neurological diagnostics. This is with permission. They did this in the course. What they're doing here is they're guessing at what who's the patient now and what are they doing? Who's the provider now? What are they doing to solve the problem? Remember, every problem has a solution. It just may be terrible, right? So you need to identify this. Like, what are people doing today? And then you guess what's going to motivate them to do something different tomorrow? What's going to motivate them to be an enthusiastic yes to change? Because nobody likes change. One article I haven't written yet, but I keep thinking about is whatever it is, it's going to be entitled "The Status Quo is Good Enough." Because that is the biggest competition to every startup. It's just doing nothing, right? Everyone just wants to do the same thing. Here's this team from the Carousel team. They went through here bunch of this is just to give you a sense. If you're interested in the iCore program, this is the framework that we have teams follow. Hypothesize, talk to people to test their hypotheses, catalog what they learned. I love in the first one here it says, "We were wrong," which is exactly right. This is what we want teams to do. Go out, guess at things, talk to people who are experts, and then say, yep, we got it wrong. Right. And then what do you do next based on that learning? So this team went ahead and did 16 of these interviews. They came through it, marked up their original life sciences venture canvas with notes, etc. And then it turns into just a red line fest, right? And this is exactly the way to do it. I can tell you, this team then went on to do what we call the National iCore program, funded by the NSF, comes with a big NSF grant. And they did 100 of these interviews over the course of 7 weeks, not just 16. And their lessons learned video was striking. They got to the middle of like interview 50, and at least in the lessons learned video, admitted they almost gave up. Like, forget it. There's nothing here. We're not going to do this anymore. And then they just happened to meet somebody through an interview that opened a whole new door to a different area of diagnostics that they hadn't even considered. I think it was ADHD diagnosis. I'm not sure. Don't quote me on that. But whatever it is, they found something to pivot to and just ran with it and left super excited, even to the point that they changed the name of the company. So all right. Revenue projections are going to be incredible. This is what everyone sees as the TAM, SAM, SOM slide, the total available market, serviceable available market, SOM, whatever that means, whatever it is. It's like it's the big market, little market, and then SOM is what you're going to obtain first, right? It's your beachhead market. What most people do is they say, yeah, cancer, huge, trillions of dollars. Sam, we're going to get half of it, whatever. Like that doesn't make any sense, right? Investors, what they want to see is a bottoms up analysis. You say, look, realistically, we're going to get 10,000 customers, patients, whatever it is, and we're going to charge them $5,000 each. That's the math we want to see. We don't care about the the numbers from like the big market research slide, and then you're just going to get 50% of it. We really do want to see the math. So let's see. Style and personalization. This is from when I'm getting teams. Mostly this is for getting teams ready for a demo day. Yeah, graphics, pictures. Pictures say 1,000 words. We all know that. Big fonts. Remember, you never know what room you're going to be presenting in. Maybe people can't see it from the back of the room. You need at least 28 point for major presentations. Don't be afraid. You think maybe scientific presentations are very stiff and formal and sincere, etc. No, don't be afraid to be yourself and to be memorable, especially in a demo day pitch, especially in a pitch where you're just trying to get somebody to come up and talk to you afterwards. Um, yeah, make it understandable. I like to say to people, especially when I'm doing some pitch coaching, I would you give this pitch to a high school student and see what they think? That's the level realistically that you're going to be looking for, unless it's an exceptionally, and you know this ahead of time, an exceptionally sophisticated investor. Assume that they're not, right? Everyone likes to seem smart, but almost always you're going to be talking about a field, a technology that probably is like, yeah, I kind of know what CAR-T is, but they may not really. So, right, understandable at a basic level. And then truly do go back. If you have a deck that's already in hand and it's 25 rangy slides, go back and go through the process of actually boiling it down to 10. Like, what does that look like? You may ultimately want to do 12 or 15 or whatever it is, but reshuffle it, put it in the order that I suggested, and condense it to the 10, and then think, does this actually convey it? So, yeah, try that. All right. With that, I was trying to do this in 20 minutes, and I think I just did, in case there was an interest in asking me any questions about this. So,
Thanks a lot, Darren.
yeah,
And
Rupa, how'd I
yeah,
do? Did I land the plane?
great, great. Now, Anya has a question.
Yep,
Go
go for it.
ahead.
Hi, thanks for that presentation. I wanted to ask about the first slide, the there's a problem slide.
Yep.
Do you, I'm kind of thinking in terms of balancing emotional like impact. Do you think something that is more of like a general statistic, like um, within 20 years, 50% of people will be age blah, 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 which
Mhm.
will have a burden and we'll see this many people with this disease and
Yep.
or like at our institution, you know, 100% of people didn't get this test.
Yep.
Everyone, um, everyone just was, oh, I can't find the right word. Um,
Well,
Everyone fell through the cracks,
yeah. If
essentially.
so, number one, of course, you want the stats to be correct, right? Right. If
Right.
dramatic, yeah. If you say, look, 100% of people have this problem, we know this because of our internal stats, for sure. It I thought the question you were going to say, because many times you'll see someone start with like, meet Sally. She has a problem, like, and it's a picture of a person, which is supposed to be kind of like an emotional connection. That is more of what we think of as like a demo day pitch technique because you have 4 minutes, 5 minutes. You want to get people hooked from the beginning. If you're doing what's a and so it's a 5 minute pitch. If you're doing a traditional investor pitch, they'll give you 20 minutes or 30 minutes, right? And frankly, when you have like the like meet meet this old woman slide, I think a lot of sophisticated investors are like, oh no. Like, okay, is this going to be sufficiently serious? However, it works in some cases. So
Okay.
it depends on the audience.
And can I just add something to that? I think sometimes also people start with the problem being the technology, like the current technology doesn't work. I think what I find useful, and I think Darren, you have this in the iCore program too, is framing the problem in terms of the human, what is the problem the technology is solving for the human? So you want to center the problem around the human, not the technology, if that makes sense.
Yeah, that's a good point. Right, many times people do start off like, you know what the problem is? That people are not adopting our technology. Like, oh no, that's not the problem. The problem, right? I get you think that, but yeah, so exactly.
Any other questions for Darren?
All right,
Okay.
all right, team. I will PDF this and send it over to you.
Thanks so much, Darren. And I will have the next speaker. And this was not planned. It was just because the timing wasn't perfect for Erica. But both Darren and Erica are attorneys. So that's an interesting connection. So Erica was a patent litigator, before that, a patent prosecutor, attorney, and before that, she did her PhD in biochemistry at UC and molecular biology at UC Berkeley and worked in the industry. And Erica, if I'm correct, was it Chiron?
Syngenta. It was Novartis
Syngenta.
that became Syngenta.
Okay, okay, sorry about that. And before that, she was an undergrad at MIT, and she has her firm in Gen City IP, and she's been a great Catalyst advisor. So take it from there, Erica.
All right, let's see if I can get this.
And sorry about the Syngenta versus Chiron. I don't know
Sorry,
why I
I'm
had to.
having a. This is not the normal sharing. thing, sorry. Your share thing does not recognize, I have a Mac, and so it's not doing what it would normally do. So I'm going to try to make this work. Otherwise, I'll just talk through it. Um,
Or you can send your slides, Nate
yeah, sorry
can
about this.
share.
I don't know why it's
I
not.
think it came quickly and then it went away.
Oh, yeah. Yeah, it's not. Sorry, folks. I'll just try to talk through it because I think at this point we're sort of low on time. So I apologize for that.
You
But
have half an hour, Erica, if you want to just send your slides.
yeah, I'll
And
try.
Erica, if you don't do presenter mode, you might still be able to share it.
No, it's
It's
not. It's
not.
like literally not letting me share anything. It's telling me that it wants to like share something out of box. I've never had this happen before. Um, yeah. Uh,
You just want to mail it to Nate or me, or
Yeah, I'll try that while I'm talking and we'll just get started. Let me see if I can shut down this share thing. Apologies, everyone.
Yeah, I just made you a co-host, maybe to see if that would enable any functioning on your end.
No, it's not doing anything, which is odd, but I don't want to spend any more time on this. I'll try to email really quickly and then I'll um give up after that. Yeah, this is not. Sorry, folks. All right, Nate. There's something, sorry. It's probably my computer, but it's not even letting me email while I'm on Zoom.
why don't you just talk through your presentation then, Erica,
Yeah, I think
and
we're
can share
there.
the slides later?
Yeah, I'm just going to do that. Sorry, folks. Okay, so from a background perspective, I advise startups on IP strategy while I've done other IP functions in the past. All my clients are small biotechs, usually between pre-seed and Series C, with a few exceptions. And they're all in the life sciences because my background is molecular biology, biochemistry, as Rupa said. So basically, what I'm going to talk about today is what is IP strategy for a small startup or someone who's wanting to pitch a small startup? What is it that investors are looking at it from an IP perspective as part of you'll be filling out the TPP. And so IP strategy at this sort of early stage is really messaging two things. How do you protect what it is that you have, what your innovation is? And do you have a clear path to market? In other words, is there freedom to operate? Are you going to be blocked by someone else's intellectual property? Is there some roadblock? Can you get around it or are you stuck, right? So, in the life sciences space, there are generally two modes of protection that on the IP aspect that tend to dominate, and those are patents and trade secrets. And depending on what your technology is, it's going to depend what that balance is. So, I'm going to talk through some just general basics about patents and trade secrets because I don't know how much you have come in contact with either of these, but we'll just talk about the super basics, right? So, a patent, right, which is issued by a country's government, like the US Patent Office, prevents others from making, using, selling, offering to sell, or importing whatever it is you're protecting, the technology that you're protecting in the patent. They're country specific, right? So you want to protect stuff in the US, you're getting a patent in the US. You want to protect in Europe, you're getting patents in European countries, in China, Japan, various South American countries, whatever your business is. You can't get patents everywhere, even if you're Pfizer, right? That we're talking like millions and millions of dollars. At an early stage, you might be asked, what are your main countries that you're focusing on from your market, which is a business decision that your IP will follow. Patents generally last 20 years from their filing date. After that, they expire. So that seems like a long time until you're in a regulated industry where you have to go through the FDA, and it might take you 12 years to get a therapeutic through. In which case, if you started your patent before you started your FDA work, you might be left with 8 years or less. So something to consider. And one big one for startups is that your patent application actually publishes before you get a granted patent. What does that mean to you? It means that your competitors can see what you're doing when you're filing patent applications. There's an 18-month delay. You also can see what they're doing, but keep that in mind. If you're wanting to stay super stealth, you might hold off on filing patent applications if you have that luxury, right? You're not afraid someone else is going to file. A lot of people ask me, what is it you can patent? So normally I have a little egg diagram, which you can't see, which has layers, right? And depending on what it is, what technology you are working on, what problem you are working on, that diagram is going to look different, but we'll take it from a therapeutic, from a drug, just as an example. So at the core, you might have your active ingredient, which is the actual, for example, peptide or small molecule antibody, whatever it is you're using that gives you the activity, right? That treats the disease. You can patent that. You can patent formulations like pharmaceutical formulations. You can patent methods of making either the active ingredient, the drug itself, or the drug and its formulation. There are methods of use, meaning methods of treatment. How do you use the drug? What is its dose? How is it administered? What diseases does it hit? Its subpopulation. And then beyond that, you might get into specific combinations. Like I have a client that has a device drug combination, right? You need to use both. It's actually a phototherapy. So you actually illuminate the tumor and the drug becomes active, right? There's a device and a drug. If you were doing something different, like a device, right, your core might be particular components, right? And that might build up to a device itself or a system, and then methods of using that system. And so in the slide set that I'll distribute, there's a couple of examples of therapeutic, diagnostic, and device, just types of things you can patent. A lot of people ask me, well, can I put them all in one patent? Do I have to get multiple patents? That's again a business and cost decision. It's also, you remember, patents have a certain lifespan, so you can actually strategically plan how you go about these layers to get a lifespan of longer than 20 years covering your product. A good example of this is an antibody drug called Rituxan. The actual antibody, probably the patent expired, I want to say, well before 2000. But there were many patents on formulations, methods of use in terms of treatment and dosing that have kept that drug alive for quite some time in different indications. Humira, which is another big antibody treatment, has a similar patent portfolio. Patents, though, do have requirements, right? And I'm going to contrast this with trade secrets. So to get a patent, right, things you will need to think about is my innovation new, right? So, for example, if you decide you're making an antibody drug and it's the same antibody that someone else has published in the literature, the antibody is not new, right? Because everyone already knows about it. It's in the literature. Or the other question, is it obvious? Is it inventive, right? Is it just a small incremental step? If I take a diagnostic probe and I add a single nucleotide to it, right? Is that really different than the original probe? Maybe it has fantastically different activity, but you'll need to think about, is it an incremental improvement or is it a big enough step that the patent office considers it worthy of a patent? You also have to explain how you make and use your invention, which sounds silly, but a lot of startups are like, well, I don't want to tell anyone how I made this thing, right? But the whole idea is if the government is giving you a 20-year monopoly, right, on this technology by getting the patent, when it expires, the quid pro quo is the patent has to enable someone to use the invention afterwards. And you have to be able to explain the invention, which is called written description. Another one that sounds kind of obvious to people, like, of course I can explain my invention, but the invention has to be in terms of like what Darren was talking about, not just the problem, but the solution. Like, what is the actual thing you are going to do in the technology that solves the problem? So, for example, you can't just say, well, I'm going to use antibodies to cure cancer, but you don't know which antibodies they are, right? Something that you will consider. Um, One of the slides I'll distribute, but I will skip over now, is there's a list of things that are considered prior art. What is prior art? It's things that came before your patent filing that would indicate that your invention is not novel or might be obvious. Things like research papers, other people's patent filings, but things like websites and what you put on social media. So keep that in mind. And then finally, for patents, one thing to consider is there are some things that are not patentable in a lot of countries. For example, in the US, you cannot patent a natural product like an organism. So if I isolate a bacteria out of a pond that is a natural organism, you cannot patent that bacteria. You can patent the use of it, but not the bacteria itself. If you genetically modify it, that's a different story. For those of you that work in artificial intelligence, right, AI driven things, there must be a human inventor. Things that are solely invented by AI are generally in most countries no longer patentable. Certainly, this has been tested. So, for example, there are a lot of companies that develop drugs using AI, but there is human intervention in selecting those drugs, and that's how they get around that. There are things that describe natural phenomena, like how a drug is metabolized in your body. Again, not patentable in that particular aspect. Other things to think about, which are more technical, and there are ways of getting around it in Europe and some Asian countries, things like methods of treating humans, surgery, certain types of therapies done on humans themselves as methods are not patentable. And that's just a policy decision of those countries. So you can patent the drug, but there are some methods that are limiting. Okay, so we've talked about what patents are. I'm going to switch gears a little bit and talk trade secret. So trade secrets are another form of protection. Basically, a trade secret is something that has economic value, and its value comes at least partially from being a secret, from being not known to other people, right? So for a lot of biotechs, things until they're patented are trade secret. A lot of technology companies, that's the case as well. You know, the classic sort of trade secrets people always sort of remember are the formula for Coca-Cola that supposedly no one knows. Um, it has a value, right? Because Pepsi can't copy it exactly. And its value comes from holding that secret. The difference between trade secrets and patents is there is no formal process, right? You don't register them with the government, you don't pay any fees, there's no formal like requirements like a patent has in terms of novelty and non-obviousness. But the biggest thing is you have to keep it a secret, right? You can't publish it, you can't talk about it in public, you can't put it on social media. So there are pros and cons, right? And so one of the things to consider, depending on what technology you are working with, is what is the balance between patents and trade secrets? It's not an all or nothing thing. Certain things lend themselves well to patenting. Other things work much better with trade secrets. So I have a chart for this in terms of the kind of compare and contrast, you know, what the differences are between patents and trade secrets. But let's take some examples. A drug that you are going to sell does not make a good trade secret. Why? Because it's not a secret, right? You're putting pills, you know, I go out and I have a bottle of pills or whatever it is, and anyone can take that back to their lab and figure out what's in the pills. But what's a contrasting thing? I make software that my customers don't get the code for, right? It's actually kind of a service, right, where they put in their data into my portal and the software on my end generates whatever, they're trying to generate, and then I send the results back. That software makes a really good trade secret because they're never going to see it, right? They're never going to touch it. It's never going to get out there. From a kind of intermediate perspective, say you are making something by fermentation. So I have a lot of clients that actually work, this is going to be a little different because this is not what the interns usually work on, but in the food tech space. So for example, making egg proteins without the chicken or milk proteins without the cow, and they're made by fermentation. This is the same thing. A lot of antibodies are actually made by cell culture. The methods you use to make those cultures grow, how you make the fermenter run, how you do the purifications, those make good trade secrets. Why? Because if you put them in a patent application, right, it publishes in 18 months. I'm over in India, I'm in Korea, I'm in Mexico, I'm doing the same thing. How are you going to know? You're going to crawl in the factory window? Probably not, right? You'll just never know I'm doing that. So I'm using your technology for free, right? Whereas as a trade secret, right, as long as you're careful and you don't tell anyone and you keep tight control of it, you might have a huge advantage about making things at scale that no one else could make. So a lot of the consideration is what is public facing in your technology, right? And out of your control. And you could tell if someone else were selling it or using it. And those make good patentable technologies. And what is sort of in the back office, right? Or the back room that no one's going to no one's going to see. And even if they had it from you, you wouldn't know that they were using. Sometimes it's easy to figure that out. There are a few situations where, again, it's a business decision. I will comment on this, and Darren, maybe you'll comment on it too. I find in biotech there is a big pressure to have startups file some patents. Sometimes prematurely, sometimes unnecessarily, but there is a group of investors that just seem to not get the value of trade secrets as much. And sometimes it's hard to communicate that you're holding something back purposely. I have a number of startups who get a lot of pressure from their boards, and their boards are made up of their investors in that way. Okay, so that's one half of it. How do I protect things? Is it patents? Is it trade secrets? There are other forms of protection that are not, some are like copyright, for example, and trademark. I'm not talking about today. They don't play as heavily in the particularly kind of the wet lab side of life sciences. But the flip side of this, what I said, was a clear path to market or freedom to operate, as Darren alluded to. And here, it's good to have an understanding, at least at some level, of what your IP space is. In other words, who else is out there that holds intellectual property, particularly patents that could get in your way? Do they have a relevance? Can you get around them? How your technology differs from that. And I think one of the mistakes I have seen startups do is when they say no one is doing what we're doing. I think that doesn't ring true for two reasons. One is science tends to build upon science, right? Ideas build upon each other. It's very unlikely that you are working in a space where literally no one is doing it. And then if you are, there's sometimes the question scratching your head, well, why is that? There may be other reasons no one's working on it. But I think it generally comes from kind of sticking your head in the sand and not really looking around and at what's out there. One urban legend I do want to dispel is a number of people, not just startups, I've had investors say this to me, that having a patent, your own patent, means you have freedom to operate. And unfortunately, that is totally false, right? So a patent is like a fence, right? You put your fence down means no one can cross over it into, quote, the territory you've put the fence around, right, that you're trying to protect. It doesn't mean that you've put the fence on land you completely own, right? A good example is when I lived in North Carolina, we put a fence down between me and my neighbor who had a big shed. It kept my neighbor's dog out of crossing over the fence. Unfortunately, it turned out that the fence was actually sitting on his property, right? So patents are kind of like Venn diagrams, right? They can overlap, right? I can own something, right? I could own a patent that covers all furniture with four legs, and you could own a patent on a table, right? They would overlap like a Venn diagram because furniture with four legs could also be stools and chairs and things, and tables could have more legs than four, less legs than four. So just keep that in mind, right? So when you're assessing your IP landscape, you're looking at other people's IP, right? Third parties. And that can be universities, it can be private institutions, it can be individuals, it can be other companies, big, small, right? And you want to get a sense of what's out there, right? That could get in your way, but you also want to keep some perspective, right? Because what usually happens is that you get on Google Patents or just Google and you type in keywords, right? And you look at, hey, I want to see who's got, patents in CAR T or particular antibody. And what you actually pull up are patent applications, not issued patents. And so those are good to be aware of, right? They tell you who's working in the space, what might be coming out of that space. But patent applications are a bit like your Christmas wish list, right? You tell the patent office, hey, I think I should own this technology space, this particular, you know, treatment or whatever it is. And it's a negotiation back and forth between the applicant for the patent and the patent office. And like a Christmas wish list, you might ask for a bicycle, you might end up with a pair of socks, right? You don't know. So when you look at these patent applications, don't have like a major freak out, right? Some of them really are applications, and these really broad claims that seem like they're going to own everything in the space are not what they're going to end up with. If you do find issued patents, then, you'll know at least what ostensibly that particular company or university has, protection over and whether that's going to be a problem. Your best bet is to work with a patent attorney on this for a couple reasons. I mean, one is to help you understand what you're looking at and to help you compare accurately what you're trying to do, what is in the patent application, because there's a lot of misunderstandings that come up where people think that they're going to have a problem that they don't, and vice versa. There's also some protection for you in working with a patent attorney, and that can be the patent attorney at the university, right? The university has their own, folks who help out with technology that's coming out of UCSF. Why is that? Because if you do find a problem, right, that problem might come back to haunt the company later in its life. The things that you discuss with the company's patent attorney, or in the case of university technology, with the university's patent attorney, are protected by something called attorney-client privilege. And while this is a long way down the road that anything could ever happen, having been a litigator for 10 years, it does happen. A lot of documents that were created, a lot of emails that were created early in a startup's life come back to haunt them. A lot of this. So I'm just encouraging you as you start to look at your IP space to use the resources that I know from the Catalyst program. There are resources at UCSF that will help you with this. And I think it's Berkeley Law does actually a startup garage that helps startups, again, work with attorneys and help them through these IP questions. So that's just a sort of small aside. To kind of wrap up here, I think from a TPP perspective, as you're looking at this, you're going to be mostly looking at what is the technology you're trying to protect? What else is out there, right? Do you think anything of what's out there is a problem, either because what you have is not new or inventive, right? If you're going to have trouble protecting it, or you're going to have an issue because you might enter into some space that someone else has already patented that could stop you or block you from going forward. And you're just going to, hopefully be able to answer those questions in a way where you say, yes, I know what's out there, but we can figure out ways to sort of steer around it. And so with that, apologies again about the slides, and I will stop there.
even without people seeing the slides. And I'm sure everyone looks forward to seeing your slides. There are a couple of questions. Anu, do you want to ask your question? Okay, if not, I'll read it. If it's a highly competitive field, is it possible to opt out of publication for a limited time? And she says her microphone is not working.
Sure. No, it's a good question. There are, I'd say yes and no. So it's not that you can opt out of publication for a limited time. There is a way you can file in the US only, right? Not worldwide protection, and do what's called a non-publication request, where the application will not publish until it's granted rather than in 18 months. And then you can purposely slow down how long it takes to grant. The downside of that is you are opting for US protection only, right? So you're giving up your worldwide protection. Um, generally, when you're in a competitive field, I guess my advice would be sit down with a patent attorney, talk about the strategy, talk about what things you are going to put in the application that's going to publish in 18 months, what you can hold off on. There are ways of filing series of patent applications to sort of mitigate those issues, but still work in a competitive space. It's again, some of this is, there's kind of pros and cons.
And Anya has a question.
Thanks. Thanks for that talk. I wanted to see if you could sort of address, you commented a little, if you could address sort of the trade secret versus patent. I'm imagining like a worst case scenario where you take the trade secret route and then someone patents something. And then you're like, well, I made this algorithm and like they patented it and I was like keeping it a
Yeah.
trade secret. What do you do?
Yeah, so that's a different, I mean, that's always a dilemma, right? Because trade secret, right, one of its downsides is it doesn't protect on what's called, independent derivation. In other words, two people come up with the same idea, they haven't stolen anything from you. So you're like, yeah, that's a bummer, right? Um, I think there are things that are there's sort of a difficulty. I guess one possibility is you first have to assess whether you think they're even going to get a patent on it, right? So people can file a patent and they may not get it. So they might not block you, but then you're still like, well, my secret's out, right? So there is that downside, right? To the extent the whole secret is out. What I find is that it's rare that like it's kind of an all or nothing thing, right? So I'm more of a wet lab person and not an algorithm person. So I'll try to talk about it in sort of I'm trying to think of a good example that might speak to this. But I have a client, right, who came up with an algorithm for a diagnostic, right? It was basically to look at whether there was a certain type of nucleic acid structure in a cell, right? And it had a lot of different data that would feed in, and then it had a bunch of, formula that it would weight to get to the answer. And it was the same dilemma, right? It was like, well, what do we do about this, right? Because it's not like, as someone might say, it's not rocket science, right? Someone else could come up. And what they would find is that people would come up with part of the answer. So, like, no one was ever good enough. So they were like, okay, we're satisfied with that, right? We'll kind of do that. They actually went the file US only non-publication route. And the strategy was this, right? And this is, I'm telling you this because it's a general strategy. It's not particular to them. It's like, we know we have a trade secret for a certain amount of time. So what we're going to do is we're going to file this US only. So it's not going to publish. We're going to hold on to it as long as time. And then as soon as we see a threat where we think someone could block us, we're going to release it. Right. And you don't have to file a patent to do that. You could actually just write a blog and like blow someone out of the water in the same way, right? If you don't want them to be able to patent, you just have to put it out there in the public. So that's the other strategy. Other strategy is say you have an algorithm and it has 5 steps, and you're like, well, you have to do all 5 to be key, but I'm going to publish 3 of them, right? Like literally, I'm just going to put it on a website somewhere. Well, now, like, okay, if they come up with all 5, then they can take your 3 and say it's innovative to add the other 2 steps, but you can see where you might kind of throw a wrench in their plan.
Thank you.
Sure.
That was very helpful, Erica. And if there are no further questions, just want to once again thank Darren, thank Erica, and I know all of you all are in the final sprint to get your presentations together, working with Sohela, working with Nate, and with myself and the teams. And so just work on all of that. Presentations will be from the middle of August with the advisors giving their comments. And this is the final TPP workshops lectures. And again, thanks, Darren. Thanks, Erica, for taking the time and for great
Yep,
presentations.
absolutely.
Bye.
Thank you.
See y'all.
Thanks, Darren. Thanks, Erica.